crash course regarding the nursing stream, all courses. So today we are going to give a crash course on first year MSc Nursing, so that this will make sure you to understand better the MSc Nursing course and the academic program as well, and regarding the question paper, everything. Okay, if you are attending our crash course, means for sure definitely you will get the knowledge regarding your particular course. Okay, so that you will gain the knowledge what to study, what to avoid, and what is the things which will be there in this particular curriculum. So without delaying, we will start our course review. Okay, when it comes to course review, I will tell you in a simple way. This is one of the PG course. So PG means what? Post graduation. So when it comes to the post graduation, you can get a degree, post graduation degree in the various specialties in the nursing stream. That and all you come to understand in the upcoming slides of this particular session. Okay, so that we can discuss later. But this is a 2-year course. The duration, when it comes to the course duration, it is a 2-year course, and you can become a lecturer by profession after getting lots of year of experience. You can be as a designated as an associate professor, principal. Okay, so if you want to do principal, you have to go with the PhD too. So like this is the basic thing that you have to gain. Okay, so as a post graduation, that is what the course review. Then this course will make you to gain a knowledge regarding the academics and the curriculum, even with the practical knowledge in the hospitals. Okay, the clinical settings also you are going to get with along with your specialty. Okay, so and keep on telling that what is the specialty. So that and all the things we can discuss in this particular session. So without delaying, we will start the crash course on first year MSc Nursing. Okay, so all of you know that already ನಿಮ್ಗೆ ಗೊತ್ತಾಗಿದೆ. ಕ್ರಾಶ್ ಕೋರ್ಸಲ್ಲಿ ಕೋರ್ಸ್ ರಿವ್ಯೂ ಇದು 2 ವರ್ಷದ PG ಗ್ರಾಜ್ಯುಯೇಷನ್ ಕೋರ್ಸ್ ಅಂತ, ಪೋಸ್ಟ್ ಗ್ರಾಜ್ಯುಯೇಷನ್ ಕೋರ್ಸು. ಮತ್ತು ಇದರಲ್ಲಿ ಏನಪ್ಪ ಅಂತ ಹೇಳಿದ್ರೆ, ಈ ಕೋರ್ಸ್ ಮಾಡೋದ್ರಿಂದ ನೀವು ನರ್ಸಿಂಗಲ್ಲಿ ಪೋಸ್ಟ್ ಗ್ರಾಜ್ಯುಯೇಷನ್ ಡಿಗ್ರಿನ ತಗೋಬಹುದು. ಮತ್ತು ಯು ಕ್ಯಾನ್ ವರ್ಕ್ ಆ್ಯಸ್ ಅ nursing officer too. Along with that, you can work in the academic sector like nursing colleges ಅಲ್ಲಿ ವರ್ಕ್ ಮಾಡುವಂತಹ opportunities ಇರುತ್ತೆ. So this course will be helpful for you to get a good future in your career. Okay, this is upgraded version. So that is why you can go with after BSc nursing if you are taking 1 year of experience, you can go with the MSc nursing course. Okay, now we can see that first one, very first we will go with the subject review of the first year MSc Nursing. Here you can see nursing education, one subject. So total 4 subjects will be there, and for different kind of specialty. ನಾನು ಫಸ್ಟ್ ಸ್ಪೆಷಾಲಿಟಿ ಬಗ್ಗೆ ಮಾತಾಡ್ಕೊಳ್ತಾ ಹೋಗ್ತೀನಿ. ಇಲ್ಲಿ ನೀವು ನರ್ಸಿಂಗಲ್ಲಿ BSc ನರ್ಸಿಂಗಲ್ಲಿ ನಾವು ಮೆಡಿಕಲ್ ಸರ್ಜಿಕಲ್ ಓದಿರ್ತೀವಿ, ಕಮ್ಯುನಿಟಿ ಹೆಲ್ತ್ ನರ್ಸಿಂಗ್ ಓದಿರ್ತೀವಿ, ಚೈಲ್ಡ್ ಹೆಲ್ತ್ ನರ್ಸಿಂಗ್ ದಟ್ ಪೀಡಿಯಾಟ್ರಿಕ್ಸ್ ಓದಿರ್ತೀವಿ, ಅಬ್ಸ್ಟೆಟಿಕ್ ಆ್ಯಂಡ್ ಗೈನಕಾಲಜಿ ಓದಿರ್ತೀವಿ, ಸೈಕ್ಯಾಟ್ರಿ ಓದ್ತಿರ್ತೀವಿ. ಆಯಿತಾ, ಅದನ್ನೇ MSc ನರ್ಸಿಂಗಲ್ಲಿ ಏನು ಮಾಡ್ತೀವಿ ಅಂದರೆ ಡೀಪಾಗಿ ಓದ್ತಾ ಹೋಗ್ತೀವಿ. ನಾವು ಒಂದು ಪರ್ಟಿಕ್ಯುಲರ್ ಸಬ್ಜೆಕ್ಟನ್ನ ಕುರಿತು ನಾವು ಏನು ಮಾಡ್ತೀವಿ ಅಂತ ಹೇಳಿದ್ರೆ, ವಿ ಆರ್ ಗೋಯಿಂಗ್ ಟು ಗೇನ್ ಅ ನಾಲೆಜ್ ಇನ್ ಅ ಪರ್ಟಿಕ್ಯುಲರ್ ಸಬ್ಜೆಕ್ಟ್. ಓಕೆ, ಇನ್ಕ್ಲೂಡಿಂಗ್ ದ ಕರಿಕ್ಯುಲಮ್. ಓಕೆ, ಇದ್ರ ಜೊತೆಗೆ ಓದ್ತಾ ಹೋಗೋದನ್ನು MSc ನರ್ಸಿಂಗ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಇದು ಎಕ್ಸ್ಪೆಷಲಿ ಬಂದು ಸ್ಪೆಷಾಲಿಟಿ ಬಗ್ಗೆ, ಕ್ಲಿನಿಕಲ್ ಸ್ಪೆಷಾಲಿಟೀಸ್ ಇರುತ್ತೆ. ಓಕೆ, ಇಲ್ಲಿ ನೋಡ್ರಪ್ಪ, ಇವಾಗ ಏನು ಮಾಡಬೇಕು ಅಂತ ಹೇಳಿದ್ರೆ, ಫಸ್ಟ್ ಸಿಲೆಬಸ್ನ ಅರ್ಥ ಮಾಡ್ಕೋಬೇಕು ಅಂದರೆ ಸಬ್ಜೆಕ್ಟ್ಸ್ ಯಾವುದಿರುತ್ತೆ ಅನ್ನೋದು ತುಂಬ ಇಂಪಾರ್ಟೆಂಟ್ ಆಗುತ್ತೆ. ಸೊ ವೆನ್ ಇಟ್ ಕಮ್ಸ್ ಟು ದ ಸಬ್ಜೆಕ್ಟ್ಸ್ ಯಾವುದಿರುತ್ತೆ ಅಂತ ಅಂದರೆ, ಫಸ್ಟು ನಮಗೆ 4 ಸಬ್ಜೆಕ್ಟ್ ಅಂತ ಹೇಳಿದ್ದೀನಿ, ನೀವು ಸ್ಕ್ರೀನ್ ಮೇಲೂ ಕೂಡ ನೋಡಬಹುದು. 4 ಸಬ್ಜೆಕ್ಟ್ಸ್ ಇದೆ. ಸೊ 4 ಸಬ್ಜೆಕ್ಟ್ಸಲ್ಲಿ ಫಸ್ಟ್ ಒನ್ ಬಂದು ನರ್ಸಿಂಗ್ ಎಜುಕೇಷನ್, ದ ಸೆಕೆಂಡ್ ಒನ್ ಬಂದು ಅಡ್ವಾನ್ಸ್ ನರ್ಸಿಂಗ್ ಪ್ರಾಕ್ಟೀಸ್, ದ ಥರ್ಡ್ ಒನ್ ಬಂದು ನರ್ಸಿಂಗ್ ರಿಸರ್ಚ್ ಆ್ಯಂಡ್ ಸ್ಟ್ಯಾಟಿಸ್ಟಿಕ್ಸ್. Okay, the fourth one is clinical specialty. Okay, ಓಕೆ ದ ಕ್ಲಿನಿಕಲ್ ಸ್ಪೆಷಾಲಿಟಿ ಇದೆ. ಇಲ್ಲಿ ಕ್ಲಿನಿಕಲ್ ಸ್ಪೆಷಾಲಿಟಿ ಅಂತ ಬಂದಾಗ ನಾವು ವೇರಿಯಸ್ ಸ್ಪೆಷಾಲಿಟಿನ ಓದ್ತಾ ಹೋಗ್ತೀವಿ. ಕಮ್ಯುನಿಟಿ ಹೆಲ್ತ್ ನರ್ಸಿಂಗ್ ಆಗಿರ್ಬೋದು, ಮೆಡಿಕಲ್ ಸರ್ಜಿಕಲ್ ಆಗಿರ್ಬೋದು, ಪೀಡಿಯಾಟ್ರಿಕ್ಸ್ ಅಂದರೆ ಚೈಲ್ಡ್ ಹೆಲ್ತ್ ನರ್ಸಿಂಗ್ ಓದ್ತೀವಿ, ಆ್ಯಂಡ್ ಅಬ್ಸ್ಟೆಟಿಕ್ ಆ್ಯಂಡ್ ಗೈನಕಾಲಜಿ, ಸೈಕ್ಯಾಟ್ರಿ, ಇಷ್ಟನ್ನ ನಾವು ಏನು ಮಾಡ್ತೀವಿ ಓದ್ತಾ ಹೋಗ್ತೀವಿ. ನೆಕ್ಸ್ಟ್ ಈಚ್ ಆ್ಯಂಡ್ ಎವ್ರಿ ಸಬ್ಜೆಕ್ಟ್ ರಿವ್ಯೂನ ತಗೊಳ್ತಾ ಹೋಗೋಣ. ಓಕೆ, ಒಂದೊಂದೇ ಸಬ್ಜೆಕ್ಟಲ್ಲಿ ಯಾವುದೆಲ್ಲ ಯೂನಿಟ್ಸ್ ಇದೆ, ಎಷ್ಟಿದೆ ಅಂತ ತಿಳ್ಕೊಳ್ತಾ ಹೋಗೋಣ. ಸೊ ದ್ಯಾಟ್ ನಿಮಗೆ ಬೆನಿಫಿಟ್ ಆಗುತ್ತೆ. ಫಾರ್ ವಾಟ್ ಇಟ್ ವಿಲ್ ಬಿ ಎ ಬೆನಿಫಿಟ್ ಫಾರ್ ಯುವರ್ ಪ್ರಿಪ್ರೇಷನ್ ಆಫ್ ಎಕ್ಸಾಮಿನೇಷನ್. ನಮ್ಗೆ ಇವಾಗಲೇ ಎಕ್ಸಾಮಿನೇಷನ್ ಇರೋದ್ರಿಂದ ವೆರಿ ನಿಯರ್ಲಿ ವಿ ಹ್ಯಾವ್ ಎ MSc ನರ್ಸಿಂಗ್ ಎಕ್ಸಾಮಿನೇಷನ್ ಇನ್ ಕರ್ನಾಟಕ, ಎಸ್ಪೆಷಲಿ RGHS ಯೂನಿವರ್ಸಿಟಿಯಲ್ಲಿ ಎಕ್ಸಾಮಿನೇಷನ್ ಇರೋದ್ರಿಂದ ಏನೆಲ್ಲ ಓದಬೇಕು ಅನ್ನೋದು ದ ಪ್ರಿಪ್ರೇಷನ್ ನೀಡ್ಸ್ this kind of crash course. Okay, so that is the intention of providing a crash course in our YouTube channel, so that you have to get the benefit of this also. Now iವಾಗ ಡಿಸ್ಕಸ್ ಮಾಡ್ತಾ ಇರೋದು ಫಸ್ಟ್ ಸಬ್ಜೆಕ್ಟ್ ಯಾವುದಪ್ಪ ಅಂತ ಹೇಳಿದ್ರೆ ನರ್ಸಿಂಗ್ ಎಜುಕೇಷನ್. ನರ್ಸಿಂಗ್ ಎಜುಕೇಷನ್ ಅಂತ ಹೇಳಿದ್ರೆ ಹಿಯರ್ ಯು ಕ್ಯಾನ್ ಸಿ ಇಲ್ಲಿ ಮೇಜರ್ ಆಗಿ ನೋಡಬಹುದು ಏನಂತ ಹೇಳಿದ್ರೆ ಫಸ್ಟ್ ಟೋಟಲ್ ನಮಗೆ 14 ಯೂನಿಟ್ಸ್ ಇದೆ. 14 ಯೂನಿಟ್ಸಲ್ಲಿ ಫಸ್ಟ್ ಯೂನಿಟ್ ಇಂಟ್ರೊಡಕ್ಷನ್ ರಿಗಾರ್ಡಿಂಗ್ ದ ಎಜುಕೇಷನ್, ನರ್ಸಿಂಗ್ ಎಜುಕೇಷನ್. ಇದನ್ನು ಎಲ್ಲಿ ಓದಿರ್ತೀರ ಅಂತ ಹೇಳಿದ್ರೆ BSc ನರ್ಸಿಂಗಲ್ಲಿ ಇಯರ್ ಬ್ಯಾಚ್ ಯಾರೆಲ್ಲ ಇದ್ದರೆ ಅವ್ರಿಗೆ ಒಂದು ಸಬ್ಜೆಕ್ಟ್ ಇತ್ತು, CET ಕಮ್ಯುನಿಕೇಷನ್ ಎಜುಕೇಷನ್ ಆ್ಯಂಡ್ ಟೆಕ್ನಾಲಜಿ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಒಂದು ಸಬ್ಜೆಕ್ಟ್ ಇರುತ್ತೆ. ಸೊ ದ್ಯಾಟ್ ಯು ವಿಲ್ ಗೇನ್ ದ ನಾಲೆಜ್ ರಿಗಾರ್ಡಿಂಗ್ ದ ಟೀಚಿಂಗ್ ಪ್ರಾಕ್ಟೀಸ್ ಇನ್ ಪರ್ಟಿಕ್ಯುಲರ್ ದಟ್ ಸಬ್ಜೆಕ್ಟ್. ಓಕೆ, ವಾಟ್ ಆರ್ ದ ಮೆಥಡ್ಸ್ ಆಫ್ ಲರ್ನಿಂಗ್, ವಾಟ್ ಆರ್ ಮೆಥಡ್ಸ್ ಆಫ್ ಟೀಚಿಂಗ್, ಎವ್ರಿಥಿಂಗ್ ವಿ ಹ್ಯಾವ್ ಲರ್ನ್ ದೇರ್, ಹೌ ಟು ಪ್ಲಾನ್ ಅ ಲೆಸನ್. ಓಕೆ, ಲೆಸನ್ ಪ್ಲಾನ್ ಹೇಗೆ ಮಾಡೋದು. ಸೊ that is a base. On the base of that subject, the upgraded version what we have studied in first year MSc nursing ಅಂತ ಹೇಳಿದ್ರೆ ಫಸ್ಟ್ ಸಬ್ಜೆಕ್ಟ್ ಬಂದು ನರ್ಸಿಂಗ್ ಎಜುಕೇಷನ್. ಸೊ ನರ್ಸಿಂಗ್ ಎಜುಕೇಷನಲ್ಲಿ ಅರೌಂಡ್ 14 ಚಾಪ್ಟರ್ಸ್ ಇದೆ. 14 ಚಾಪ್ಟರ್ಸಲ್ಲಿ ಫಸ್ಟ್ ಒನ್ ಬಂದು ಇಂಟ್ರೊಡಕ್ಷನ್, ಸೆಕೆಂಡ್ ಒನ್ ಬಂದು ಟೀಚಿಂಗ್ ಆ್ಯಂಡ್ ಲರ್ನಿಂಗ್ ಪ್ರೊಸೆಸ್, the third one is measurement and evaluation, the fourth one is standardized and unstandardized tests, the next fifth one administration, scoring and reporting, and the next one is standardized tools, nursing educational programs, containing education in nursing, curriculum development, teacher preparation, guidance and counseling, administration of nursing curriculum, management of nursing educational institution, standards and accreditation. ಓಕೆ, ಇದೆಲ್ಲವನ್ನ ಓದ್ತಾ ಹೋಗ್ತೀವಿ. ಇದನ್ನ ಓದೋದ್ರಿಂದ, ಈ ಸಬ್ಜೆಕ್ಟ್ನ ಓದೋದ್ರಿಂದ ನಮಗೆ ನಾವು ಹೇಗೆ ಒಂದು ಎಜುಕೇಷನಲ್ ಸಿಸ್ಟಮಲ್ಲಿ ವರ್ಕ್ ಮಾಡಬೇಕು ಆ್ಯಂಡ್ ವಾಟ್ ಎವರ್ ದ ಮೊಡಾಲಿಟೀಸ್ ಇರುತ್ತೆ ಅದನ್ನೆಲ್ಲ ಹೇಗೆ ಕವರ್ ಮಾಡ್ಕೊಳ್ಳೋದು, ಮತ್ತು ಅದರ ಜೊತೆಗೆ ನಮಗೆ ತಿಳ್ಕೊಳ್ಳುವಂತಹ ವಿಷಯ ಬಂದುಬಿಟ್ಟು ಹಿಯರ್ ಯು ಕ್ಯಾನ್ ಸಿ ಅಡ್ಮಿನಿಸ್ಟ್ರೇಷನ್ ಆಫ್ ನರ್ಸಿಂಗ್ ಕರಿಕ್ಯುಲಮ್ ರಿಗಾರ್ಡಿಂಗ್ ದ ಪರ್ಟಿಕ್ಯುಲರ್ ಹೌ ಟು ಪ್ಲಾನ್ ಆನ್ ಅಕಾಡೆಮಿಕ್ಸ್. How if you want to teach means certain teaching skills should be needed. Okay, so those kind of skill will be taught by this particular subject. Okay, what is curriculum, what is academics, what is how to plan a timetable, construct the curriculum, how to construct the lesson plan, how you need to prepare as a teacher. Okay, whatever the learning process will be there, teaching learning process, all those things will be included in this particular package of this particular subject, nursing education. That is what 14 units will be there. Okay, all the units are very important. I will explain you in the question paper pattern. At that time I will explain what kind of question you will expect from this kind of every kind of subjects. So far this subject is over. Now ee subject illige mugitu. Next now nodona ಫಸ್ಟ್ ಇಯರ್ MSc ನರ್ಸಿಂಗ್ ಸಿಲೆಬಸ್ಸಲ್ಲಿ ಸೆಕೆಂಡ್ ಸಬ್ಜೆಕ್ಟ್ ಬಂದು ಅಡ್ವಾನ್ಸ್ಡ್ ನರ್ಸಿಂಗ್ ಪ್ರಾಕ್ಟೀಸ್. ಇದರಲ್ಲಿ ನಮಗೆ 9 ಚಾಪ್ಟರ್ಸ್ ಇರುತ್ತೆ. 9 ಚಾಪ್ಟರ್ಸಲ್ಲಿ ಫಸ್ಟ್ ಒನ್ ಬಂದು ನರ್ಸಿಂಗ್ ಆ್ಯಸ್ ಎ ಪ್ರೊಫೆಷನ್. ಇದನ್ನು ನಾವು ನರ್ಸಿಂಗ್ ಫೌಂಡೇಶನ್ನಲ್ಲೂ ಓದಿರ್ತೀವಿ. ದ ನೆಕ್ಸ್ಟ್ ಒನ್ ಹೆಲ್ತ್ ಕೇರ್ ಡೆಲಿವರಿ ಸಿಸ್ಟಮ್ಸ್, ಎಪಿಡೆಮಾಲಜಿ, ಬಯೋಸೈಕೋಸೋಷಿಯಲ್ ಪ್ಯಾಥಾಲಜಿ, ಫಿಲಾಸಫಿ ಆ್ಯಂಡ್ ಥಿಯರೀಸ್ ಆಫ್ ನರ್ಸಿಂಗ್. ದಿಸ್ ಇಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ chapter. You have to study hard because you are going to implement all the theories, whatever the theories will be present over in the nursing. That is very important point of view to remember this chapter and study well. Okay, the next one, nursing process and approach and psychological aspects of human relations, nursing practice, computer applications for patient care delivery system and nursing practice. Okay, so this is what you are going to study in the advanced nursing practice, same like as the nursing foundation will be there, that is the upgraded version of this particular subject. Whatever the things you have studied thereover, you are going to upgrade the knowledge regarding the particular things only. How the healthcare delivery system will be there, what is epidemiology, and the nature, human relations, psychological aspects of the human relations, nursing process, approach, the theories especially. Once again I will tell you, the theories are very important to know and very important to study well. You have to apply all the theories. Okay, so for that reason you have to study all the theories very well. Make one notes that for theories only. Okay, make notes and objectives of the particular theory, who given the theory, everything you have noted down, and you keep it one side, and every day you will open it and you will see. Means no need to study harder, bit harder. Every day we are studying means definitely we can remember the things very easily. Okay, so consistency is matters a lot. Okay, so build that kind of practices in you and you can achieve your course very well. Next thing is research and statistics will be there. Here you need to understand the next subject. See here, part A, part B, like that they have divided this particular subject. The part A consisting this nursing research. Okay, nursing research, here we have around 12 units: introduction, review of literature, research approaches and designs. What kind of design you are going to use in this your particular research. Yeah, being a MSc Nursing, later I will explain what is the curriculum will be there, how it has been designed. Means we have to do a research on a particular things. Okay, so that how we need to do, how we need to pick a problem statement, how we need to do, what kind of tools we need to use, what kind of approaches and design we can use in that particular research to conduct, and what is the review of literature, how you need to write a review of literature, what is the criteria we need to follow, what it should be focusing more in this particular thing, everything. Okay, then research problem, then development theoretical conceptual framework, sampling, how to collect the samples, tools and methods of data collection, implementing research plan, analysis and interpretation of data, and data in the sense information. Okay, then reporting and utilizing the research findings, critical analysis of the research and reports and article. After completion of your research things, you have to report it and you have to result. Okay, the result needs to be reported. So that kind of things you have to study in this particular unit. Developing and presenting a research proposal. Okay, so these are the 12 units you are going to study in the part A of the nursing research. Okay, don't be confused that nursing research and statistics, it is a one subject, but in this particular subject they have divided this subject as nursing research and nursing statistics. Part B. Let us see the part B, statistics, nursing statistics. Here what it will be happen, introduction will be there, measurement of the central tendency, measures of variability, normal distribution, mean, mode, median, frequency, everything we have going to study here. And next one, measure of relationship, design and meaning, significance of the statistics and significance difference between the two statistics, that is what the testing hypothesis, and use of statistical methods in the psychology and education, application of the statistics in the health, and next one is use of computers and data analysis, how we are going to use the data analysis and computer knowledge as well. We are going to study in the statistics part 2. Okay, so you can understand here we have a 10 units in the part B, statistics. So research and statistics togetherly counting means we will get the 22 units. Okay, so the subject is bit bigger than other subjects, so you have to focus more on this particular subject. One more tip is that it is a dry subject. Okay, so you have to study very well, then only you can able to write in the examination, otherwise there is a chance to forget the things. Okay, you have to study every day. Next one is clinical specialty. Okay, here I will explain. In this particular video only we took a one particular subject. Okay, if you want means you can go through RGHS website, there you can get the syllabus copy, or else you can download our application, there also you will get the syllabus copy and you can go through the syllabus copy of your particular subject. Okay, which means specialty. This clinical specialty already explained. Various clinical specialties are there, what you have chosen that matters a lot. Okay, so the first one is medical surgical nursing. Suppose so in this particular video I am going to explain only about this one. Okay, so you can see here medical surgical nursing introduction. So total 17 units are there. So same what we have studied in our BSc, same like that, only various systemic wise disorders we are going to study. That's what we have mentioned here. You can see introduction regarding the medical surgical nursing, history, the trends, everything we have seen in this particular subject. The next one, health assessment of the patients, care in hospital settings, management of patients with disorders of gastrointestinal tract, management of patients with disorders of nervous system, then same like that respiratory system, cardiovascular, blood, genitourinary, endocrine, musculoskeletal, integumentary, which means we are going to study related to the skin. Okay, eye and ENT, both the ophthalmology and as well as ENT. Okay, so ear, nose and throat we are going to study here. And the next one is reproductive system. Okay, we are going to suffer with the reproductive system disorders, what is the management we should do. Okay, so that kind of things we are going to study in this particular specialty. Okay, the next one is geriatric nursing, 15th unit. So geriatric nursing means we are going to study about the elderly disorders and disease conditions. The next one, management of the patients with communicable and sexually transmitted diseases. Okay, so you are going to study about the STDs and communicable from person to person. It is going to be transfer. What is the management? What is the measures to prevent those kind of things? That is the thing we are going to study here. And the last one is emergency trauma and multi-system organ failure management. Okay, so that is why this last will be very important. Okay, so here along with this emergency we are going to know so regarding the critical care nursing also, so that makes sure you to gain the knowledge in this particular emergency trauma section. So these are the 17th very important units in the particular specialty. We have ops and we have pedia, and as well as we have one more specialty, psychiatry. So those kind of subjects are having a different units or chapters under the particular specialty. If you want, that means please go and download our applications Nursing Guru, so in the Play Store, so you will get the syllabus copy over there. Okay, next we can move towards this examination pattern. Okay, so this examination, how the examination will be there, how many hours will be there, so lots of doubts will be there for you as a fresher. So that's why you have to gain the knowledge regarding this also, very important. See, you can see on this screen total we have 3 hours of theory examination and as well as 2 kinds of examination will be there, don't be confused. So when it comes to the examination pattern, we have a theory and practical kind of examination. Okay, and one day only, no theory, no practical. Okay, that like that and all, no, nobody will going to conduct the examination. Don't be confused like that. So after finishing of theory only, they will conduct the practical examination. Okay, this is the criteria they are going to follow. See, you can see here we are going to, when it comes to the theory examination, focus on the theory examination. Here you can see only theory examination you can focus. Here we can tell that the theory examination consisting of all subjects. Okay, nursing education, advanced nursing practice, A&P, nursing research and statistics, and clinical specialty first. Okay, that's what you have taken, medical surgical nursing, ops, pedia, all those things. Next you can see that 3 hours of examination will be there. Total marks will be 8. Okay, the total is 100, but you are going to write the examination, theory examination for 80. The next one we can see that 20 marks of internal examination, like internal assessment will be there. That should be they will conduct the internal assessment test, and your performance, along the basis of those kind of performance, they are going to provide a marks. Okay, conducting viva, your clinical activities, skills, everything they will assess, and they are going to provide a marks for you. Next one is external. When it comes to the external, 80 marks will be there. So that is what the theory paper you are going to write. Okay, so the 80 marks, you have the question paper pattern. That time I will explain what is the question paper pattern will be there, what kind of question you are going to explain, and the next slide I will explain. Now we can see the practical. Okay, nursing education practical will be there. So the marks is 100 marks. So there what it will be happen, 50 marks is internal, 50 marks is external. So the examination they are going to conduct for the exam, what your topic will be there, that you are going to micro teaching, and so many aviates presentation, everything will be there. Okay, there only you are going to present your topic, everything it will be there regarding the particular topic. You have to choose, and you have to present in front of your examination, internal and external examiner. Okay, the next one is clinical speciality. When it comes to this clinical speciality, internal and external, when it comes to that, first, for example, only we have two subjects of practical examination. One is nursing education, the second one is clinical speciality. When it comes to this clinical speciality, 100 marks. Okay, so the 100 marks will be there for practical, 100 means for internal 100, for external 100. Okay, total 200 marks will be there for your clinical speciality. So that you have to go for a hospital clinical setting, you have to present one case, and you have to answer for a viva, you have to demonstrate the particular procedure. So along with this kind of practical examination, you are going to score. Okay, so now we can see the question paper pattern. Here you can see the previous year question paper. For example, here we have 80 marks, total marks is 80. Okay, so the total marks is 80. You can see here, you can see here, answer all the questions. So here only you can see, your answer should be specific to the question asked. Draw a neat label diagram whenever necessary, they given. Okay, so this should be, keep it in your mind, and wherever the diagrams are necessary, you can please draw that particular diagram. Okay, next one is describe the complications of cirrhosis of liver. Okay, so they are given according to the particular subject. Here I took a clinical clinical speciality, medical surgical nursing. You can see total 10 questions will be there. Okay, the 8 questions will be there. One question carries 10 marks, total 80 marks. Okay, there is no short answer, short essay, not like that. All are long essay kind of questions. You have to answer for a 10 marks. Total 8 questions will be there for all the subjects. Also same like this only, this kind of examination pattern, paper pattern only. Okay, so don't be confused in that. So this is how the examination will be there for the MSc Nursing first year. Okay, so in this session we have studied about this course review of your MSc Nursing. Okay, so this is a 2-year course. Tomorrow session we are going to see about the second year MSc Nursing examination, means examination, not crash course. Okay, so that you will gain the knowledge regarding the particular also. Okay, so we have seen that regarding the examination pattern also in the previous slide. Okay, so far this will going to be helpful for you to gain the knowledge for your particular course and achieve a good marks in your examination. Next we can see the examination pattern and all we have seen, right? So we can see that how we need to write an examination tips I will tell you. Make sure you have to go before the examination. The time should be like commencing time before half an hour and all. You have to be in the examination center, be calm before going to the examination, and prepare well. Okay, do your preparation from day itself, because if you are not started means we are very near to examination. So for that reason you have to study, and make sure take all the previous year question papers and study according to that. That will make you to score better marks in your examination. Hmm. Next, present answer in a very good way, that matters a lot. So use the schematic representation whenever required, and use diagrams whenever required. Explain very well. For sure this will make you to get a good marks. Okay, thank you so much for attending our crash course. Hope this will help you to gain the knowledge regarding first year MSc. Thank you one and all. Subscribe to Nursing Guru.